Oh, I should look at it. Okay.
All right, so Della, what's your vision of what CBH will look like after 2 years? How will you know that it's successful, that it worked? What will be happening in the communities?
If we have more women, pregnant women seeking regular antenatal care,
Mm-hmm.
long after the program has ended,
Yeah.
after the program has ended,
Mm-hmm.
and if we have women not delivering with traditional birth attendants anymore, but actually going to the health facilities to have their babies, and if we have more women who, after they have their babies, go for postnatal care, is very key for the survival of infant and neonatal mortality. So that's very key. If you have more women doing that in the districts in which we are working and in the region, after the program is ended, that is a sign of success. And also early breastfeeding. If we have more women who attempt to breastfeed soon after they've had their babies, and
Mm-hmm.
would do that exclusively for 6 months, and that practice is kind of ingrained into the culture. So it's like it's normal for women to, after they have babies, to just start breastfeeding, and would do it exclusively for 6 months, from support from the community as well. So if somebody is not doing it, there's a sister or a mother-in-law, or somebody to encourage her to do so. So if there's that going on within the communities, these four or five things, I think that will show that we have succeeded with community benefits health program. That is on one level. Then the other is if it contributes in the long run, so this is impact, in the long run to improved maternal health or maternal mortality ratios in the entire country. So now we're moving beyond Upper West region to what the picture is in Ghana as a whole. And we're able to achieve MDG 5 by next year and beyond. I think that is a sign of success for CBH.
Those sounds like goals for the Ghana Health Service. I mean, how is this project different? How does it complement what the Ghana Health Service does and not compete with what it does? And what's the role of the community in all of this?
The Ghana Health Service has 1,000,001 programs aimed at improving health, and embedded in that health is improving maternal, newborn, and child health. They have several programs: Safe Motherhood, High Impact Rapid Delivery Program. They have Free Maternal Health Initiative. Just to mention a few. But when you still look at our statistics across the nation, we still have a long way to go. Even Ghana Health Service themselves have acknowledged that we need more partners. No one actor can do it alone. So JICA is doing some, UNICEF is, there are several actors involved in the health sector, and including the maternal, newborn, and child health sector or health service delivery. So Ghana Health can't do it alone. Otherwise, we are in 2014. 2015 is next year, and our maternal mortality ratio, in spite of all these interventions by Ghana Health Service, still stands at 350 per 100,000 live births. So we need everybody on board to help us move, accelerate progress towards improving maternal, newborn, and child health. Then you asked about the role of communities. Yeah, Ghana Health Service is kind of like the supply side. So they'll provide the health service that you need. But if communities don't go to demand or uptake the services, then we still stand at a zero. So if you are crying for poor infrastructure, so I have to walk 10 kilometers and there's no clinic. And now Ghana Health Service has provided chips, and the communities are not walking to the chips. Or they've provided you with a midwife now at the chips, and you are not walking to the chips to access the service. So communities have a big, actually, it's a 50-50 thing. So Ghana Health Service is on the supply. They have provided the service. Now the communities have to uptake the services. So that is where education, MNSCH messaging comes in, to encourage people to go for the services. That's
That's
the
where
Ghana.
CBH comes in.
Then that is where CBH comes in. Yeah, because a lot of it, CBH is more on encouraging the demand side uptake of maternal child health services. So we take the messages to them why you need antenatal care, why you need to go to the health service for delivery, because when you do it at home, you can die from bleeding, and the traditional birth attendant, for instance, cannot save you at that point. So when all these messages are said over and over and emphasized, and there's encouragement from the entire community to support it, then we'll get the communities now to uptake the services that Ghana Health Service is providing.
Example on that, on that tip. So, we we say we want to empower communities to improve health behaviors, what do we mean by that? What do we mean when we say we want to empower communities to improve health behaviors?
You see, when we empower somebody, it means that you're able to take some decisions, level of decisions on your own. You understand the issues, and based on your understanding, you take certain actions. So, for instance, if a woman is pregnant and needs health care, and she has to sit in the house and wait for her husband to come from the farm in the evening to say, okay, can I or can I not go for to see the doctor because I have this condition? That is what culture has, some culture practice has taught her. But if we go with the messaging on CBH and we tell her, look, your health is key, it is important, and then we teach you that there's community support. So if your husband is not at home, but the community emergency transport system, for instance, is in place, and they can help transport you to the clinic in the absence of your husband, then you have the knowledge and you have the community support. So you are empowered, like you have some power to take those health seeking decisions that will improve the health of pregnant women.
And how would people, what role does CBH as a project play in empowering people, women, for example, like you just talked about, to make these decisions? What role does CBH play?
You know, CBH doesn't do like like a blanket tailoring intervention. So we look at the various segments within the communities that impact maternal, newborn, and child health. So, for instance, there's special targeting of women, there's special targeting of mother-in-laws who play a key role, there's special targeting of the youth, like adolescents and young females. So when you have tailored messages for these people and they have the knowledge, then you are empowering those women, different categories of women, especially the mother-in-laws who are very influential within the communities. You are empowering all of them to take the best decisions, you know, moving and encouraging people to access skilled delivery, to go for antenatal care and all the postnatal care and exclusive breastfeeding and the other things we're talking about.
Great.
I need a bottle of water.
I'll give you two. You were great.
Thank you. Thank God I didn't